But I'll tell you, it was hard to get in. You know that. It was very hard to get in. It's hard to get out, and it gets really hard when you get out. And I remember we all looked at each other and we're like, well, that's not a very encouraging thing to say. But it is not an easy path by no means.
Hi, everyone. Today on the podcast, I'm excited to host a Signet client and now friend of mine, Dr. Arundhati Ghosh. She is a force. She is so humble. She is a surgeon. She is on the faculty at Harvard Med School. She reviews applications for med school. She is the curriculum director for surgery at Harvard Med School. She also mentors students, both in her capacity as a faculty member and outside of that, just out of the goodness of her heart. She finds so much joy in mentoring. And as I've worked with her family, she and I have gotten to know each other quite well. And I've always been so impressed with these little stories that she throws out every once in a while. And I wanted to have her on so that our listeners could hear that there are many roads into medicine. And there are some great reasons to become a pre-med, and there are some good reasons to not become a pre-med as well. And the value of having that perspective that there are always going to be bumps in the road and that a team of mentors is really, really helpful in helping anyone navigate those bumps. So take a listen. I hope you enjoyed as much as I enjoyed talking with her today. Arundhati, thank you so much for joining us. I always enjoy our brief conversations. I'm really excited to be able to talk to you more in depth about your story and what you do and what our students and families can learn from you.
Well, Sheila, thank you very much. I'm really excited to speak to you today.
Great. So let's start with the beginning. Tell us about where you grew up and how you decided to go into medicine.
Well, as you can probably tell from my accent, I'm from India. I was born in India, grew up there. In terms of my journey in medicine, I decided I knew I wanted to become a doctor fairly early on. So I think I was in middle school, and I have a very clear sort of recollection of that when I visited my own pediatrician, when I met the doctors, the fact that they could lay a hand on your belly and figure out what was wrong with you, I just found that magical. And I definitely wanted to have that power. So for me, the decision to, when did I decide to go into medicine was pretty early. Now, people join that trajectory, enter medicine, and make that decision at different points in their lives, and it can be very varied. But for me, it was very early when I was probably in middle school. I knew I wanted to be a doctor.
I love that. I love that story. So, in India, the education system is obviously different from the system in the US. And so, there's a big test that you'll have to take. And depending on your results, you will be allowed to go into certain fields.
Yep, that's right. So actually, the US is probably a bit of an outlier. Indian system, like the British system, and in most parts of the world, actually, you enter med school after high school. So there's a big high stakes exam at the end of your 12th grade. There are several exams offered by different institutions in the country in India, depending upon which institution you're trying to get into. But it's called a joint entrance examination for engineering and medicine, and hundreds of thousands of kids take that test. It's a written test, and based on the score, based on how you rank, you get to pick which college or university you would be joining. So it was a very high stakes, nerve wracking exam, and I still remember how absolutely overjoyed I was when I saw my name on the list of successful candidates. And I was admitted to the Calcutta Medical College, which is supposed to be the number one medical college within the West Bengal, which is in the eastern part of the country. Yeah, so I did all my surgical training in UK, and then I'll cut to the chase and say I had to redo all of my training here in the US because that's just what was required. So I did my surgical training again here at Beth Israel Deaconess Medical Center at Harvard. And after my chief resident year, I joined as faculty at the Cambridge Health Alliance. And I am a general and gastrointestinal surgeon with a special interest in endocrine surgeries, so thyroid and parathyroid surgeries. So that's my clinical role. And luckily for me, I have been involved with education right from the start. So I am also the clinical director, the curriculum director for surgery for the Harvard medical students who do their rotation at Cambridge Health Alliance. So that's a very big part of my what I do and what occupies my mind. Yeah.
So you're designing curriculum, you're also teaching students, yes?
Correct. So the curriculum at our site, so Harvard Med School has four hospitals that are available to Harvard Med students for their clinical learning and clinical rotations. Ours is one of the sites, and three other big sites are MGH, Brigham and Women, and Beth Israel. So some 20 years ago, almost now, the then dean of HMS designed a curriculum, wanted a reform, and the idea was to try out a very new type of curriculum where the students would have a longitudinal sort of involvement with the patients, with the teachers, mentors, and with the curriculum. So a complete redesign was done of the curriculum, and it was piloted at our site. And I helped design the surgery component of that curriculum. And I've remained as the curriculum director. So I manage the curriculum, but I'm also an active preceptor and teacher within the curriculum. Yeah.
And as if that's not enough, you are also a researcher.
Well, I won't say I wouldn't call myself a researcher. It's mostly educational research, which I have the benefit of having all kinds of awesome people around me. So, yeah.
Okay. So I guess the thing that I want to emphasize is that you have seen the system from a lot of different angles.
Uh huh.
Obviously, you've been a student, you are a practitioner, you are a surgeon, you are an educator. You're designing curriculum and you're also teaching people. And then, however much you want to minimize the research, you also do some research. So, I mean, that establishes you, I think, as an expert. And I'm really excited to hear more of the twists and turns in your story. But one of the things I thought we could start with is your thoughts on what makes a successful medical student. Like, who should really be pursuing medicine given the way, education is structured and the requirements of the work?
Yeah. So before I answer that question, I think I will preface that by saying that most of us, most of us outside of medicine actually do not have an idea of what the profession entails. So I think there is no set number of things that are must that a student must have. Okay. If I was to say, I mean, if I was to put the thing that's number one, would be the student's own personal drive, desire, and ambition to become a physician, to become someone who will wants to understand medicine, figure out what's wrong with people, and fix the problem, take care of patients. That is an internal drive and desire. I don't think you can, and most certainly you should not try to be a physician if someone else wants you to be one. I don't think it's possible. It's a really difficult career. So I think I would put number one as a sort of need or parameter that will determine whether you can make it in this journey is your own burning desire to be a doctor, to be able to take care of people, to be able to work hard. You have to be willing to work really, really hard. This is not an easy road by any means. I always tell my students, I mean, if you think you're coming into a profession where people are going to, students, especially these days with all the awards and this and that, the focus is on the student up until the point that they enter med school, and especially when they enter clinical medicine. They are the center of the universe. But once you enter a hospital, once you enter clinical medicine, you are not the center of the universe. The patient is. You really don't matter. The patient matters. And that is a major paradigm shift. And it's an important thing to understand that everything you do is geared towards the need of the patient. You, in your needs, in your family's need, comes behind that. It really is a demand of the job. I don't know if it will change over time, but that desire to put other people's, that you will do what is necessary, whether no matter how hard you have to work, how much you have to study, that you really want to do this, I think that is the number one driver of success.
I'm so glad you brought that up. I mean, I know you know my story a little bit, and maybe some of the listeners do as well, though I haven't told it in great detail. But I went to Harvard as a pre med. My father is a doctor. My brother is now a doctor as well, and it was just sort of expected of me. And I do like helping people, which is why I do this, and I love doing this. And I loved science. And so I thought, okay, this is a great fit. And it doesn't matter so much that it was my dad's idea because I also like this idea. But as I got closer to, my application year, I was, listening to other voices in my head that were telling me, no, actually, this is not what you want to do. And I'm really glad that I was able to make that decision, though it was very hard to disappoint my family in that way. But one of the things that I see nowadays, and this might be a little bit of a departure from what we were talking about, is a lot of students being interested in medicine because, of course, who doesn't like helping people? That's a nice thing to be able to do, right? But they are really interested in medicine because it seems like this is a very clear path. You do this, then you do that, then you do this, then doctor, right? Whereas most other fields, with the exception of a few, there's no real clear entry path, right? There isn't step one, step two, step three, the way it's really clearly laid out in medicine. And I've had multiple students just in the last year tell me, I'm really attracted to medicine because I don't have to think. Someone else is going to tell me what to do. Of course, they're going to have to think about, what to do with their patients and in their classes. That's not the thinking that they're trying to avoid, but the thinking is the decision about what comes next on the pathway. And I think it'd be interesting to hear your perspective on that because you've taken additional steps that not every doctor needs to take. And that, I think, motivation of yours to help people figure out what's wrong and solve the problem has probably led you in a lot of different directions. So talk to us about that a little bit.
I think you've made a very important point. I couldn't agree with you more, Sheila. That is very, very true. And the point that you made, I realized it just recently, actually. I mean, I've been in the field myself for a very long time, so it's not something I think about or why others are coming into medicine. But you're absolutely right. This is one of the few professional tracks. It's a professional track, and it's a track that is well laid out. The broad structures are very well laid out. So you are absolutely right that for the person looking at it, once you're in it, that's it. You don't have to do the thinking. The track is laid out. And people from a range of different backgrounds and experiences and trainings are coming into it because of that reason, because the track is laid out. And because the med schools have opened up a lot more, it's not just people who, science students, students from all manners of backgrounds, realize that, okay, this is a track that I can follow. You are absolutely right, Sheila. But the problem with that is that the track is laid out, but not understanding the demands of the career, not understanding what you are going in for, could lead to enormous frustration and unhappiness and bitterness and whatnot. So the track is laid out for sure, but that doesn't mean the track is for you.
And it doesn't mean it's an easy track, right?
Oh gosh, no. It is not easy. You know what? I'll tell you something very funny. So when I joined medical college, I remember distinctly the first day we was sitting in the lecture theater and the principal walks in and he, we're all excited. We are in the premier medical school in the state. And he walks in and he says, so I know you guys are all excited, but I'll tell you, it was hard to get in. You know that. It was very hard to get in. It's hard to get out. And it gets really hard when you get out. And I remember we all looked at each other and we're like, oh, that's not a very encouraging thing to say. But it is not an easy path by no means. So, for students who are successful, you have to be very organized. You have to have very good planning skills, looking ahead, to be able to multitask, set priorities, timeliness. So, being an organized person is big help because as a physician, that's actually a big demand on a physician's time, doing 10 different things at the same time, prioritizing. So being organized is a very valuable skill. The other big one is communication. You have to be a good communicator, or certainly it's a huge help if you're a good communicator. People skills. You have to be able to get along with people, work in a team. That's a big one. And of course, cognitive skills, learning, analytic skills.
Yeah, that's really helpful. I'm glad we went back to that. I think one thing that I also see among students is a focus on, let's say, science and math to the exclusion of what people might consider soft skills, things that you learn in the humanities, how to communicate, how to read people, how to compromise. But especially in a high stakes, high stress career like surgery or any other type of medicine, I think those soft skills can be extremely valuable. And I'm curious if you can speak to students who may want to go into medicine, but maybe they studied English or they studied foreign languages as their college major, even though they completed their pre med requirements alongside of that.
That's not very uncommon, Sheila, these days. It's not very uncommon. I think you can come to a career in medicine from a range of different backgrounds. But I do think it is important to have solid analytic skills. So if you've majored in the humanities, I think as someone who's looking at an application, as someone assessing potential candidates, I would like to see that you have done very well in your analytic science subjects, because that is very important in medicine. So it is by no means a problem or issue if you have majored in the humanities, but I think you need to have solid analytic skills.
Yeah, I think that makes sense. Yeah. Okay, so we talked about what makes a good medical student. Is there anything different that you would say makes a good doctor or a good researcher?
So, I don't, anybody who has is past a certain age and has dealt with the issue, had children, dealt with, has a family, you know how hard life is. Life means challenges. It's a series of challenges. And the negotiating medical school, and you become a practicing clinician, and around the same time, you have all of the challenges of life in general hit you. Just like in any other profession, being a successful professional is not just about being successful in your school, but having a lot of other abilities that help you navigate the challenges of life. You you need a village to support you. You need family. You need to have friends and family around you. You need to be able to take care of yourself. You need to have hobbies. You need to have a life outside of medicine. You need to be able to handle stress and failure. You have to learn how to handle failure. So there are all manners of challenges that you have to handle outside of the world of medicine while you're a practicing clinician. And just like in any other profession, you need all of those skills to allow you to navigate life and be a successful doctor.
That's so great that you mentioned that because that's actually my next question. I know that you do mentor students, and I'm curious what you see the role of mentorship being in this career path, this educational journey when students are thinking about going to med school, when they're in med school, when they're applying to residency, as they move through, their postgraduate training. What's the role of mentorship?
I think mentorship is extremely valuable. I look back on my own life and trajectory, and basically it was just bumbling along without any help or advice or knowledge. There was no internet, no nothing, so just kind of just stumbling upon, just figuring it out. And I wouldn't recommend that to to others. It's I think it's very, very, very helpful to have a mentor or mentors. Mentorship isn't just a one person, like a one block thing. You need to have supporters, people around you, a coterie of people perhaps who will advise and support you on the various aspects of your developing career and developing life. So it may not be just one person, and usually I would say it's probably good to have more than one person. I find an immense amount of joy in mentoring. And I've thought about it a lot. Why does it give me so much joy? And I think I find my professional life to be extremely fulfilling. I do a good job. I love what I do. I find a lot of fulfillment in it. And I love to help other young people achieve that fulfillment in their life. I mean, it's just very, 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 very nice. Every single day of my life, it's very cliched, but I save lives. And that is a very enriching and fulfilling experience. And I love to help students experience that enriched fulfillment. And if you get that sense of fulfillment in your profession as a doctor, it means that you're doing a good job as a doctor. And that means that there are a whole lot of people who are benefiting from you being there. So I would love to help others in that journey and thereby help a whole lot of other people. I just love it.
Oh, that's so amazing. I mean, you've described in a nutshell why I love doing what I do, because it has this network effect, right? And it's so powerful. So, can you give us some examples of the kinds of mentorship that you do? Like what stages are you mentoring people? And then we'll talk about how do people find you? How do you choose your mentees?
Well, mentorship is a big part of what I do officially within my capacity as the curriculum director. But unofficially, outside of my job, outside of Harvard or Cambridge Health Alliance, I kind of have been doing this for a very long time. It started sort of very casually, so over I forget when, but started with one of my friend's son who was considering a career in medicine, and I had him spend time with me. So since then, I've had many students who are in high school and perhaps more who are in undergrad, in pre med, and also postgrads. They've had thought about medicine late in their lives. So, high schoolers, undergrads, postgrads, and more recently, some med students who are already med students but need guidance and mentoring about what they want to do next. So they've come to me for help for all the different aspects, from admission to medical school, whether they are suited for it, how do they know whether they're suited for a career in medicine, to help navigating the medical application process, to deciding whether should I go for MD or MD PhD, should I do research, and for the med students, what specialty do I choose? Should I choose neurosurgery versus this? So the full spectrum, really. The mentoring involves a full spectrum from high school all through graduates of med school, and in fact even beyond that. And so I've mentored people in all stages of their career.
That's just so fantastic. I just imagine how much they must benefit from your, deep experience in all of these fields and your perspective on these things. So, I mean, lucky them, but it sounds like you benefit just as much from working with them.
Absolutely. I love it. I love being for the younger, young people. I love being around young people. It keeps me motivated and keeps me up to date. And I'll tell you, one of the things, the reasons I like mentoring is, in my own journey, there were times when I did not do well as a resident, or because of life challenges that had faced me at those various points. So there are times when you may not do well, but that does not mean that you will not do well eventually, or that you cannot overcome that particular hardship. So I love to help students negotiate these bumps they're inevitable bumps in their lives. And I love to help them negotiate these bumps because they will come. And I know from my experience that it was very hard to face that hardship. I knew how good I was, and here I was underperforming. And that was very hard internally to face the fact that I was underperforming. But I knew that I was underperforming because of XYZ life challenge, and that was a temporary thing, and I'd overcome it. So I love to help students negotiate their bumps.
Yeah, that's so great and keep perspective. Well, I think that's a good place to wrap things up. And if people want to learn more about you or seek out your mentorship, where can they find you?
Okay, so the mentorship that I do outside of my official capacity for my hospital and for Harvard, I try to keep that quite contained, and I'm very selective about it because my primary role is to take care of patients. So I'm selective about it. But Arundhati at medicineadvisory.org is my email.
That's great. And I'll make sure that's in the show notes so people can find it.
Okay, okay.
Great. All right. Well, thank you for your time. I know you're busy. You got to get back to patients and students and all sorts of things, but thank you. Thank you so much for spending time with us.
Thank you, Sheila. That was awesome.
Well, there you have it, folks. I hope this was helpful to anyone who is considering a path in medicine, because I think she shared some real gems about what that process looks like and what you need to be thinking about as you move through it or decide to go into it. Check the show notes for her contact information and come back for more great conversations on Don't Force It. Thanks, everybody.